It's Monday, June 27th, 2022. I'm Jonathan Lau, and this is 5 Minutes of Proof, a weekly analysis of the science behind ozone therapy. Today, we're going to take a look at probably the oldest article we've looked at yet. And I've chosen to do that for a couple of reasons. One, it was the oldest article that I had access to. And two, it was done by Dr. Velio Bocci. And three, it showed that ozone therapy actually doesn't really help with something. And I thought, we're always looking at stuff ozone therapy does help with. Why not take a look at something that it showed that it wasn't really efficacious in treating? So this is called Lack of Efficacy of Ozone Therapy in HIV Infection. And it was introduced into the Clinical Microbial Journal of Infections in 1998. So there were studies all the way back to the 1950s. It's just that I don't have access to the actual studies themselves. So here it is. On July 1995, we decided to investigate whether a well-standardized method of ozonated autohemotherapy could affect immunologic and virologic markers of the course of HIV-1 infection in drug-naive patients. So a few patients decided they didn't want the typical treatment. So what did they do? The treatment consisted of collecting 300 grams of blood from each patient in a Baxter bag for autotransfusion and exposing it to 300 milliliters, so 1-to-1, of 5% ozone at a concentration of 67 milligrams per liter or microgram per milliliter. So that's a high concentration, especially Velio Bocci later on in his usage of ozone decided that usually they would stay around maybe 40, 50 micrograms per milliliter in their treatment of the blood. But 67 was safe. Anyway, so let's see what they found out. These treatments were carried out twice weekly for at least 16 sessions. So you're looking at 8 weeks, more or less. No patient reported any side effect, and hematologic parameters remained stable or improved. A few patients noted decreased incidence of oral candidiasis and herpes labialis. So there were some positive results, I guess, in that regard, but not in what they were looking to accomplish. Plasma HIV-1 RNA and leukocyte HIV-1 DNA levels were not significantly affected by the treatment, suggesting that ozone does not express a direct virucidal effect in vivo. Repeated measurement of relevant virologic markers indicated that ozone therapy carried out with an accurate and reliable method neither improves nor worsens the dynamics of HIV-1 replication. So that was their findings. Those were their findings in this particular short study. It was interesting to me, again, for the reasons I already mentioned. And we need to know. Ozone therapy works for so many things. There are things that it doesn't work for, and we can't be naive in thinking that it's going to work for everything. However, we know the underlying mechanisms that are at work and at play can have a positive effect on the body regardless, even if it's just anti-aging. I was looking at one of those today. Studies. It can have a positive effect because of how it works to increase antioxidants, of how it increases blood flow properties and oxygenation and ATP at a cellular level. It can help to slow down even the aging process. So anyways, this was an interesting study. That's all we have for today. Thank you for being here, and we'll see you next week.